Good evening, friends. We will discuss today about the importance of lateral implants in dental implant procedures. Okay, so when we need to place the lateral implants, so lateral implants are needed when there is a failure of crestal implants. What is the meaning of a failure of crestal implants? The conventional implants which are placed in the cancellous bone, that is in the crestal bone. So if there is a failure, why failure happens? And there are many reasons for failure. One is screw loosening, or otherwise if there is any improper mechanical forces, or if there is no integration at all, or if there is other problems after the integration due to mechanical forces, uneven distribution of the occlusal forces. So these are all the reasons for the failure of the crestal implant. So when there is a failure of the crestal implants, instead of going for any bone, okay, let's continue. So when there is a failure of the crestal implant, instead of going for any bone augmentation procedures like grafting, membrane placement, or increasing the height of the bone, that is vertical bone augmentation, all those things, it will take time for the patients, and also it's an irritation for the patients for the more appointments. So the patient has to come many more times. So again you have to do the surgical procedure, again the lengthening of the procedure's time, all this involved here. So instead of, when there is a failed crestal implants, instead of going for any augmentation procedure, so go for the placement of the lateral implants. So what are lateral implants? These lateral implants are placed beside the failed implant. So for that we have to thoroughly analyze the available bone through the CBCT radiograph. Then we have to take out the failed implant and place the lateral implant. So the lateral implant usually placed will be the bicortical screws or the compressive screws that is used in the basal implantology. These lateral implants, mostly we use the bicortical screws or polished surface implants with only minimal threads which engages in the cortical bone. So since the surface and the shank of the implants is polished, it will not cause any kind of peri-implantitis or any kind of infection, and these lateral implants will go and engage in the cortical bone. So these are also called as bicortical implants. So this is should be the replacement for the failed crestal implants. So how is the procedure? Procedure is whenever there is a failure, you have to open the full thickness flap, that is vestibular full thickness flap should be opened, and you have to make a vertical slot to remove the implant. So keep it in mind before doing the osteotomy. During such cases, you have to think about the first point is to place your new implant. There is a lateral implant osteotomy should be the first priority before that should be done. So then the failed implant should be removed. So keep it in mind, the osteotomy for the new lateral implant should be the first priority. So you make a vertical slab and do the osteotomy for this lateral implant placement. So you will decide about the osteotomy, the diameter and length of the implants depending upon the CBCT reports. So you do the osteotomy for the new implant, lateral implant placement. Then you go for the disengagement, that is to remove the failed implants. How to remove the failed implant? Usually the failed crestal implant will slip back into that slot area where you have made the vertical groove. So through that you can easily remove this failed implant, or otherwise you can cut the failed implant through the metal cutter and you can remove it in pieces. So that should be the procedure how to remove this failed implant. After the removal of the failed implant, you can engage this new implant depending upon the dimension and the diameter you have chosen according to the measurements from the CBCT. You place the lateral implant, and for this lateral implant, the new lateral implant, for time being, for temporary the processes, you can use the old bridge which was given for this crestal implant if possible. You can adjust and you can adjust that old processes and give it for some time for the patient. It is possible sometimes. Or otherwise, if it is not fitting properly, you have to go for the new processes for this newly placed lateral implant. So after the placement and the temporary crown fixation, all those things, you have to close this laterally open the flap and then go for the immediate functional loading with this lateral implant. So in this video, what I am trying to explain is Instead of bone augmentation procedure you do after there is a failed implant, go for the placement of the lateral new implant, which is a bicortical implant which engages in the cortical bone, and it will give you good stability and anchorage, and upon that you can do the immediate functional loading. Your treatment also completes in a short period. So, and also the patient will be at ease. See, after there is a failure of the crestal implant, if you are going to do these procedures of bone augmentation again, opening the flap many times and then giving the graft, so it takes a lot of time, and also the duration of all these procedures will be more. So don't go for all such procedures, go for the placement of the lateral implants. The procedure how you place the lateral implant is opening the full thickness flap buccally, that is vestibular flap should be opened, then you make a vertical slot. So keep it in mind, first osteotomy for the new implant should be made, then the bone which is needed to remove, the failed implant should be removed, then you can take out the failed implant and place this new lateral implant in the new osteotomy site, then you can do the immediate loading. Thank you so much.